This podcast is for entertainment purposes only, not medical advice. If you've ever left your doctor's office feeling confused, feeling like you're crazy, feeling like something is missing, feeling like I didn't get what I wanted, this person is not hearing me, this episode is for you. Today, we're here on Rebranding Menopause with Dr. Stephanie McNally talking about medical gaslighting.
So I think it's important to give a little historic of where the term gaslighting came from.
Right, which is interesting because I always tell my husband he's gaslighting me and he has no idea what it means. Now he does.
and there's a difference too between feeling dismissed and really gaslighting, but it's very interchangeable.
Right.
It means that somebody's not listening to you.
Right.
So gaslighting came actually from a play in the 1930s that was then made into a movie, which our leading lady won an Academy Award for. And what the husband did was psychological manipulation. He actually changed the lighting in the house and convinced her that the change that she saw or was experiencing was not real, but it was.
Right, and she thought that after a while.
Correct. So
Right.
she started to believe things that were in her head, but they were reality.
Right, right.
So in the medical world, if you were experiencing something and somebody is not listening to you, there probably is a disconnect and you need to find an advocate because you're noticing something, it needs to be recognized and not dismissed.
Right, and that's such a valid point because so many women that even today, right, I say to you all the time, I feel like I'm really just like beating a dead horse, always talking about, HRT and finding a doctor that understands you. But even to this day, there are some women that say, yeah, my doctor told me that it's not for me. My doctor told me that there's a lot of research that this causes cancer, that they still don't know to this day. And it is almost December 2025. The black box label has been removed from hormone replacement therapy and people still don't understand.
Well, and to that point, and this is exactly where podcasts like this are giving evidence, is the education needs to catch up with the science.
Right.
And the science needs to expand because the long-term data is still in evolution. So I think that's part of the reason why people are still a little hesitant. But to go back to the gaslighting, if you feel that something's off, you need to find somebody that's going to listen.
Right.
And then if the medical community hasn't caught up, you've got to find somebody that understands. And there's so much information out there.
Yeah.
What is based on long-term data? What is based on short-term data? What is based on one formulation of hormone versus another?
There's so much. It's like the Wild West. It's just sometimes it's overwhelming.
And that's what kind of when we were debriefing before is where there's so much information. Mm-hmm. It's about really breaking it down to the definitions and what are your symptoms. You need to have somebody that's going to listen. These are the things I'm experiencing. What are the right interventions and what data do we have that's long-term, short-term, not really sure? This is where you have to meet a patient where she is.
Right. But I think this is just my opinion. If I'm going into the doctor for the first time and I'm really going to be honest about all my symptoms, I'd like to give people just a little tip. Write down all of your symptoms because so many times we get to the doctor and I don't know for what reason, but our brain just goes blank, right? And we're like, shit, I wish I would have asked that question or this question or told them about this experience. So I think jotting down everything that you're experiencing, because as you've told me in the past, when you go to see your gynecologist and you think you're in perimenopause or menopause, whatever it may be, sometimes the blood work isn't necessarily the end all to be all if you're wishing to go on HRT. Is that correct?
That is actually the exact point, and all the information swirling where blood levels are going to vary, especially in perimenopause.
Right.
I encourage patients to come in. Give me your list.
Right.
We have to go through it one by one, and I may not be able to fix everything today, But how do we start to piece together the puzzle?
Right.
And that's exactly it. Be empowered, go in. And that's what happens with the gaslighting. You may come in with a list and, oh, no, it's just your hormones.
Right.
No, you're too young to be in perimenopause.
Right.
No, we've got to figure it out together.
So another thing that's on that list is anxiety, depression, right? I mean, I felt all those symptoms and felt like I was crazy. I really felt like I was crazy. My hormones would just, and I didn't know this at the time, but my anger would just spike to I can't even tell you the rage that I would have over something so small. Rage. And now that I am regulated, I feel so much calmer. I feel like such a nice person.
And I'm sure everybody's family is thrilled about that.
Right, exactly. But that's the other thing. I mean, that could be a whole other episode. It honestly can. About the effects of you not fixing your shit or understanding this, the effects on your family. Or the effects on your husband, right? You are this normal person for so long, and then, your hormones start to go off a little bit, and you become, in some cases, like I became, a complete lunatic. For real, a complete lunatic at times. And then they're left looking at, what the heck? What's happening to this person? What happened? And why are they behaving like this to me?
And I love how you're saying the word regulated, because when people come into the office, they say, I want to balance my hormones. But if you are in that reproductive stage of your life, even into perimenopause, when you're still having hormonal production, it's not balanced without you taking exogenous, meaning outside hormones, whether it's a birth control pill, a ring, a patch. There's so many things that could be interacting, but your body is naturally doing this, these ebbs and flows. So when your body starts to make less of something, it really is noticing those changes, and the connection with sleep, hot flashes, mood, cardiovascular health is all very real. Mm-hmm. So for you to come in with that list, I'm feeling not myself, that is actually the most common symptom.
Right.
And the gaslighting piece is, it's just your hormones.
Right.
Well, yes. How can you help me fix it?
Right. Or, you might need to lose a little bit of weight. You need to sleep better. You need to, work out more. It's all of those things. And, as much as I was so thrilled on November 10th, which will be ingrained in my mind forever when the FDA removed the black box warning, in a way I was pissed. I was like, how did this take so long? How did this take so long? And thinking about all the women that weren't able to experience what I'm experiencing. And then I felt like a real sense, an obligation to tell the younger generation, guys, you're sipping your little lattes, at 38 years old, thinking nothing's happening to you. But guess what? You really need to know how your, everything starts to really decline, even when you're 35, 40 years old. How your eggs are starting to, I don't want to say the word dry up, because I hate that. It's gross. But you have 2 million eggs when you're born, and then what is it? When you're 35, you have almost 10% of those, and then at 40 you have 3%.
It declines.
Holy crap.
Declines. And actually, and this is a statistic I love to tell patients in education, the most number of eggs a biologic female has is when she is 20 weeks gestation in her mother's uterus.
Oh my God.
So literally downhill from there. But
right.
The ovarian aging process, the way we're hormonally interacting, is a field and a topic that is evolving. And you're right. Where were we for decades? I mean, the regulations to have women in research as part of a mandate didn't happen until the 1990s.
Right.
So think about it. We are not, and I did viral videos about, we are not small men with boobs.
Right.
Different biology. It's so wild to think it's taken this long. And part of it is that what we're giving people now is different than when we're in some of the initial studies, the Women's Health Initiative.
Right.
And we were talking a little bit before. So that study, the primary outcome was looking at cardiovascular disease. But then when they started to pull apart the data, then they realized, a woman at 50 is different than a woman in her 70s. And the average age of that study, they were in their 60s. So all of this time frame and what hormones they were giving and what we're giving now is all in evolution.
Right.
But you're right. How do we start to educate people? It's about definitions and keep repeating, and it will start to get ingrained in our brain.
Yeah. So as far as the gaslighting is concerned, what is your suggestion when someone feels like they're being gaslit by their doctor? Let's go through like the top 3 things you should do.
Okay. So first of all, ask another question. Is it somebody having a bad day? We want to give everybody the benefit of the doubt. Why are you not listening to me? Or do you not feel that you have the time for me? Do you not have the knowledge? What am I not communicating that you're not hearing me?
Right.
So that's first and foremost. Try again. If somebody's not listening to you, you need to find somebody else.
Right.
Because again, the most common thing I hear is, I don't feel like myself.
Right.
Something else is going on. And what we don't want is to then just assume, medically dismiss that it's just perimenopause, right? We don't want the pendulum to swing the other way, where there are physiologic things that need to be addressed that we don't want to be missed in the medical workup.
Right.
So ask again, ask a different way. Find somebody that's going to listen and do a full workup for other things, not just perimenopause. And the third piece, and this is really the crux of it, is you've got to continue to educate other people. Because if you're talking about it and I'm talking about it, that education piece and the empowerment, that's how we break down all of this gaslighting. That's how we break down the dismissiveness. And even when we talk about earlier than perimenopause, endometriosis, PCOS, women are suffering in pain, painful periods. Oh, that's just normal. It's not.
Right.
So to be able to ask again, to make sure you're getting a provider that's going to listen and has the knowledge, and then you giving that knowledge to other people and the empowerment.
So another question.
I love her questions.
You have no idea how many people will call me on a weekly basis and say, well, obviously you're booked she's booked to capacity. I mean,
I do my best.
I've sent so many people to her, but now there's so many women wanting a provider like you, and they maybe live in a different state. They cannot find someone.
Right.
Right. So what do you say about the MIDI and the Alloys of the world?
So for the access with telehealth, women should be getting the access that they need, however it is best for them. Right? That's the goal. Get the care you need. Now, for many systems across the United States, this idea, this fact that women's health is important is taking fire.
Right.
Every pun intended. So what we need to do is make sure that if there are medical systems that have these programs built in, find that, because it may be telehealth and in-person visits. So the digital is, to me, a supplement to the in-person care.
Right. I think that's exactly right. I think it's a supplement, because there's nothing that will replace going to see your gynecologist. But talk about medical gaslighting. I have been told by several women in my family who are over the age of 60, 65, that they, pardon me, they don't need to come back to the gynecologist anymore. Okay? I am blown away by that, because I sat down with a bunch of my family members who are older, because I feel like that's a demographic that's unheard as well. Between 60 and 80, 60 and 90. These are women. Some women still have a great sex life in their 60s and 70s.
Right.
And now they do have certain problems, but now they're being told, you know, insurance isn't covering certain things anymore over the age of 60, 65. What do we do with that?
So that's an extremely important point to bring up. What insurances cover versus what is guideline recommended versus what a woman needs are going to be 3 separate things. So
that's huge.
Huge.
Right? So, you know, if you're a woman that only has a certain insurance coverage, what do you do?
So it depends on why you're going to see your clinician. Mm-hmm. So
let's just say UTIs.
UTIs,
right? Because
you should
I
be
think
seen.
That's the most, to me, as far as the research that I've done, I don't know about you, but that seems to be the most common denominator that women have that are over the age of 60, the UTIs.
That is an extremely common diagnosis for women, especially over 65 or even menopausal. So to go back to why is this conversation happening? There are guidelines for Pap tests where HPV, which is the human papillomavirus, a causative virus for cervical cancer and vaginal vulvar cancer. When a woman looks at her lifetime and the Paps and everything has been normal for almost a decade, the risk assessment for developing a cancer associated decreases significantly. So some of those guidelines are based actually in really good science, good data. But that's not to say somebody shouldn't come in for other issues or concerns or problems. And that's where the medical community, all of us, need to be listening to why a woman needs to come in.
Right.
So a routine PAP is very different than a full menopausal consult, is very different than a problem visit. And that's where we have to be listening to the patients, not saying you can't come in because your insurance won't cover it.
Right.
Why are you coming in?
Right.
How can we help you? That's 3 separate issues. And I think that is such an important part to bring up.
So if a woman is over the age of 60, now I just really don't know this, but when do you have to, when do you not get a Pap smear anymore?
So there are guidelines, but guidelines are not absolute laws because people's lives evolve. So if we're saying a decade Paps are normal, if that person has a new partner or something has changed, if there's been bleeding, if there's a new part of her life, the Paps have to be reconsidered and reevaluated for her individual needs.
Okay, so this is a really good point, because if you're reading between the lines, this is what I'm thinking in my head. And you probably can't even say this as a doctor, but there are certain ways around getting insurance covered. But not ways around, but really, like, some people think that, okay, because I'm this age, I can't get my Pap smear covered or whatever it may be. But if they don't realize that there are ways that you can get things covered by just like what you said. If your partner has changed, or if you have bleeding, or if you have any other issues, it's not a definite. It's not just a line drawn in the sand.
And to that, I want to piggyback. It's not even about the insurance. More of it is, why are you coming in for your visit? Because an annual GYN visit has a very limited amount of things that are covered, but a problem visit, a consultation for other things, now that that black box warning is removed, should women be on vaginal estrogen for their lifetime? These are conversations that have to be re-engaged. So it's not even about changing why you're coming in. It's to identify why are you there to begin with, because you should be checked if there's an issue.
Right. Because a lot of women, or a lot of doctors, like I follow Dr. Mary Claire, I love her. They're saying that you should be on hormone replacement therapy for the rest of your life.
And that's where the data is evolving, and the separation of that systemic, something that's going to affect more of your body versus that local vulvar vaginal treatment. They're very different. The absorption for that local treatment is such a minuscule amount that it does not have that systemic effect.
Right.
So that difference is important. Like, what are we talking about, systemic or local? And local treatment, like you were talking about, decreases not only the sexual health component concern, but UTIs, which cost the healthcare system so much, and women's lives are affected.
Right. So I also heard a statistic that 30% of women who have bone loss from not, being on hormone replacement therapy can break a bone or a hip or something like that. And 30% of them don't make it within the first year.
So there's a lot in that to unpack. So that's what, when we were talking about hormone therapy,
like, that's what I mean about gaslighting. Like, you don't know what, like I said, it's the Wild West, and there's so much information given to us so quickly. What do you believe?
So you want to believe validated tests. You want to believe the Menopause Society, ISHWISH, ACOG. These are governing bodies that are looking at the science, and people that are saying we don't have the long-term data to know exactly what we're going to be getting.
Right.
So it's about truth setting. It's about fact setting. And those are the people that I would be going to when we're talking about all of this inundation of information.
Yeah.
What has been studied? Was it the primary goal we were looking at? Was it something that we saw later? Was it something studied in 10 women or 5,000 women?
Well, that's another great point, because there are studies that I've looked at on certain topics that we'll discuss in another episode about vaginal estrogen for your face.
Oh, we're going to talk about so much.
I can't wait for that. But there are 17 studies on vaginal estrogen for your face, just as an example. There are like 6 of them that only use like 80 women for 10 weeks. Those suck. Those you cannot, like, I wouldn't look at that study and say that was a successful study, or the results from that study is something that I would take, as fact, right? But then there was other studies that used thousands of women for a very long time that I'll say, okay, I could deal with that.
And that's exactly how we should be approaching all of this information. Mm-hmm. How many women? Where were these women from? Was it a small population? Was it a large population? Do the women in the study look like me?
Right.
Do they have the same medical issues that I have? So that's where we as women don't want to be gaslit. We want to take the information and be very strategic about what we using
as evidence or our facts.
Right. Is it fact? Is it fiction? Is there an association? Is it a direct causation? It's a lot, but that's why we say definitions matter. And even just giving a little precursor to the facial estrogen, there are different types of estrogen. There are different types of progestogens. Not everything when we say hormone therapy is exactly the same. Mm-hmm. And that's where we need to be very specific on what we're doing and why we're doing it.
Yeah. There's so much to unpack.
So much. And it's exciting.
It is exciting.
Because now we're talking about it. We're actually giving women voice, because can you be on hormones the rest of your life? Is it local? Is it systemic? This is an evolving field. So for me, everything that's being done is awesome.
It is awesome. It is awesome. When I look at what I looked like a year ago, before I started a GLP-1, before I started hormone replacement therapy, before I started all of this and really taking care of my body. And believe me, it's a full-time job. Some people like to go to Michael's and craft. I like to figure out what's going on with my body.
I craft this.
I mean, some people, and you know what? I learned that from my mom. I mean, she was always investigating. She's so smart. But some people will look at my mother and I and say, oh my gosh, they do so much to themselves with the creams and the this and the that. You like to go to Michael's and do your crafting? We go to Sephora. Yeah. Like, that's just our thing.
But to that point, you know what works for you, right, and you have your agenda set of these are the things that I need to work on for me.
Right.
And that's really the take home. What are your questions? Get them answered.
This is another gaslighting issue, okay? A lot of women will say, I want to age gracefully. I don't want to go on hormone replacement therapy. I don't want to have a laser treatment to my face. I don't want to have all these creams. I want to use my Dial soap and I want to age gracefully. That's amazing for you. Don't shame me into wanting what I want for my body. But the other thing is, it's not about aging gracefully, because guess what? You're not going to age gracefully. You're going to age like an old bat. If you're not taking care of your bones and your body the way you should, you're not going to age gracefully. Your longevity is going to suck.
And it's the longevity that really should be focused on health span, not lifespan.
Right.
And
health span, that's exactly right.
Correct.
Do you want to live till you're 95 but be in a walker when you're 75, or do you want to be running around until you're 85, 90?
And for some people, that hormonal therapy is the right intervention. And when we talk about what foods to eat, what exercises to do, how do you reduce stress, it really has to be based on the individual.
Right. Like, there's so many different ways you can take. You don't have to be on hormone replacement therapy, but there's so many other ways you can take care of your body. Just take care of it. I don't care what you do. Just learn how you can take care of it. the way that's good for you.
My grandfather used to say, my body is a temple.
It is.
And you're right. You have to treat yourself kindly. And that's that whole wellness piece.
Yeah.
It's about mind, body, what is working for you. And if I told a patient, lose weight, sleep better, reduce your stress, cut out caffeine, and not a sip of alcohol.
Yeah.
I wouldn't be authentic to reality.
Right.
And what do I do with a patient, or what does good look like? What is great? And great is listening and meeting the patient and finding what works for them.
Right. But I also think women have been so accustomed to suffering or not feeling well because we've been gaslit for so long,
right,
that it's normal to feel joint pain, and it's normal not to get a good night's sleep, and it's normal to feel not 100%. And it's not normal. It's not normal to have the symptoms that we have for so long and not address them and not fix them the best that we can. I'm not saying everyone's going to be, completely 100%, but at least your doctor knows that you're trying. At least your doctor knows that you're interested in making the effort to make these changes as well.
And you mentioned before, it's work.
Right.
It's not an easy fix, but it's going to be, what can I actually do? What do I want to accomplish?
Right.
And there are ways to make you feel a little bit better. I'm not telling you to rechange your whole life. It's what are your goals and what can we realistically do together? And that's where the hormone therapy, the GLP-1, the diet, nutrition, anti-inflammatory, and supplements are also very interesting, because not necessarily the gaslighting, but is there misinformation?
Right.
If you are truly eating a balanced diet, getting all your food and all your nutritional needs from foods, then you're going to need less supplements because you're eating that balanced diet.
Right.
I am guilty of not always eating a balanced diet.
Right.
But that's where, do you need supplements? That's where supplements are helpful to supplement what you're doing already.
Right. Well, listen, we could go on and on and on, but we're going to stop here. And we are going to talk about our next episode, which is going to be the different types of hormone replacement therapy.
Okay.
Because there's so many different types that I don't think people are aware of. So I would like to, and I have my whole pile here with me.
Love it.
I have my patches. I have my testosterone. I'm going to show you guys everything. So in our next episode, stay tuned, because Dr. McNally and I are coming back with what is hormone replacement therapy, what are the different types of hormone replacement therapy, how do you use them, when you use them, the whole 9 yards. So subscribe and stay tuned.
I love that.
Hey, New York. I'm Harvey, proud owner of Optics and veteran in the eyewear industry. Consider this. Why would someone have a closet full of shoes but only a few pair of glasses when eyewear is the only accessory that completely changes the way you look, feel, and the way you're perceived? At Optics, Cartier, Chanel, Dior, Lindbergh headline our extensive collection of luxury eyewear. Our opticians are trained to style and fit your face to ensure that when you leave Optics, your friends will be wondering where you shop.